just to give you a little background with me, I'm a retired school social worker, and I would say that one of the things that I did as a school social worker that I found very fulfilling, but also very challenging, and that was to be part of the leadership team for crisis response in schools. And unfortunately, too many times we had school students who died by suicide, or even staff who died by suicide, and then we would come. If we were asked to come in to the school, we would come in and then help them to coordinate their response to that suicide death, as well as to provide any kinds of services that that might be needed to determine what those were. We also did some nice collaboration with the community and agencies that were available in the community, as well as churches too, who certainly could take a real nice lead in helping to support families and students under those circumstances. However, I also have some unfortunately, personal experience with suicide. I had, I would say, probably the first that I really remember very well was a friend of mine in college, and that was very, very difficult. And then also, I've had a person a friend from my church, actually, and also I've had a family member who's really struggled with at times with some suicidal ideation and thoughts, and then I did lose a niece to suicide. And I think it's particularly difficult when you're in the helping profession because of the self-doubts. And I'm sure even if you're not in the helping profession, a suicide death, the grief is so complex, and we're always looking for the answer. Why did this happen? And so it really does make it I think in a lot of ways, a much more complex kind of grief process that people go through. So this is something that's near and dear to my heart. I really want to be able to try to help get information out there to people, and to also help to empower people, because we really, you don't have to have a PhD or an LISW or anything after your name in order to help other people who might be struggling with a mental health crisis, or with somebody who is maybe feeling somewhat depressed or anxious or that sort of thing. So there's really a lot of power in the relationships that we have with other people. And I never want people to underestimate that. There's also a lot of resources available, and we'll be talking some more about those today. It's also important, when I think, to churches too, to learn what are best practices for if there is a suicide death in their congregation. What are the best ways to support the family, to support the rest of the congregation, that sort of thing too. And I'll be providing some resources for those things. Amy, could you bring up the slide? I think it's slide number 3, actually. We've kind of, or actually go to slide number 2 so people can see what's on the agenda for today. This won't be very helpful to you, Stephen, but I'll read it off so you can know what's there.
It's up now.
Okay, now I'm not seeing it for some reason on my screen.
Does anybody else see it?
Okay, let me just change my view. There we go. So we're going to be talking about the risk factors and warning signs for suicide, as well as protective factors. We're going to go over the role that faith communities can play in suicide prevention, intervention, as well as postvention. Look at least some overview, and you'll have access to the resources available for this work in preventing suicide as faith communities. And we're going to have some time also for some reflection, as well as questions that people might have. Go ahead and go to the next slide. This is a number I want you to remember: 11 minutes. 49,000 people died by suicide in the United States in 2022. And that is one suicide death for every 11 minutes. We also know that this doesn't include those who have been, that maybe attempted, or those who were thinking of it, those who are suffering. So I think it's just important that we keep in mind that this is an issue that impacts many, many people. The other thing to think about is the ripple effect that a suicide death will have, how it will impact the loved ones of those who they lose by suicide, and the community and professionals who have maybe worked with that person. It really does have quite a strong ripple effect, and so that is something else to keep in mind. So let's talk a little bit about what are some of the risk factors. And when I talk about risk factors, it's kind of like risk factors for like a heart attack, okay? There are some things that aren't necessarily going to result in a heart attack, but it might make you at a higher risk for having a heart attack, like high blood pressure, for example. So some of the risk factors that make it more likely for a person maybe to have some suicidal ideation or thoughts, or even attempts, is prior attempts. So that is definitely a risk factor. Alcohol or misuse of other drugs can be also something that can be a risk factor. You can see mental disorders, especially mood disorders, anxiety and depression. Access to lethal means. So, you will notice if you look at statistics that men are at higher risk of actually dying by suicide, and that could be because maybe maybe they have these thoughts more frequently than women, but it also can have a lot to do with the means that they tend to choose, which tend to be more firearms, and firearms, of course, are even the lethality of a firearm is so high that the likelihood of dying from a firearm is so much higher than even like ingesting, like overdosing on medication or that sort of thing. So access to lethal means is something that we are really wanting to look at when we're talking about suicide prevention efforts. If someone's lost someone to suicide, social isolation of a person, any chronic disease or disability, and lack of access to behavioral health care. And that's a huge one, and it's a huge one in our state. I believe that we are 48th in the nation when it comes to access to mental health care. Sometimes there can be precipitating factors. So those might include a change in life circumstances, such as a death of a loved one or an end of a relationship, an arrest, financial problems, those sorts of things. You can go to the next slide. So these slides here are about warning signs, and there's a lot of training available. I just want to make that clear about how to respond to these warning signs. And I really do, it's way beyond the scope of an hour presentation. And I would really encourage that congregations consider getting training in how to respond to these warning signs, how to respond to even the risk factors and that sort of thing as well. So when people start talking about unbearable pain that they're experiencing, or feeling a burden to another person, or feeling a burden to others, maybe having a fascination about death, or feeling hopeless or worthless or trapped, those are things that you really want to be aware of, and pursue more information from them if they're saying those kinds of things. Talk openly about your concerns. Saying things like, I noticed that you were telling me that you have been experiencing really, really a lot of pain recently. I'm wondering, because I care about you, if you can tell me more about that. And then just listening and active listening to what they have to say, and being curious to learn more about that. And then finally, even saying something like, from what you're telling me, it makes me wonder, sometimes people who are experiencing those things have thoughts of suicide. And I'm wondering, have you been thinking about killing yourself? Those are really hard words to use, but they are life-saving words to use. So they're very important to practice. Practice saying it in the mirror, practice, with somebody else, just saying it so that you can get comfortable with those words. My experience in using that kind of language with people is that it's not off-putting. I've had to ask that question many times in my experience with responding to suicide death in schools in particular, but even on a personal level. And every time I've ever asked that question, people, a lot of times, are like, oh no, that's not what I'm thinking. I'm not thinking about that whatsoever. But I've never had anybody say, oh, I can't believe you've asked me that question, like that they were somehow insulted or anything like that. So keep that in mind. It's very important. Like I said, it can be very life-saving. So not only what people talk about, but sometimes there can be changes in moods or changes in behavior that would be an indication of a warning sign or a red flag that something might be going on and they might be thinking about suicide. But certainly any recent attempt, giving away prized possessions, withdrawing from friends and community, people who usually are willing to be with people or wanting to be with people, maybe withdrawing. Again, increased alcohol or drug use. Sometimes people might have a loss of really taking care of themselves, either with their personal hygiene or how they dress, saying goodbye to family and friends, changes in eating or sleeping habits, also being a victim of violence can also be an indication of somebody, might be a warning sign about somebody that might be thinking about suicide, or expressing rage or being violent with others. So both, either being a victim of violence or also somebody who's causing violence to others might be a warning sign. If somebody does indicate to you that they are thinking about suicide, it is important that you ask them how you can help, ask them what they need, and let them know that you will help them get help and that there is hope. I think it's also important for people to keep in mind that many people think about suicide. It's really not super uncommon. And for people to know that, it's not unusual to have those kinds of thoughts, but it's also, there's hope available. There is treatments that we know can work. There is hope, and giving a person hope, as well as accompanying them to a mental health professional by either calling 911 or 988, or by maybe taking them to a mental health access center, that sort of thing, are some options that you can. So certainly if a person is talking about immediate harm to themselves or others, or they are planning to attempt suicide, or they're acting in an erratic manner, that you're really concerned about their personal safety, or you're concerned about maybe even your own personal safety, call or text the 988 crisis line, connect that person to a mental health professional. I think it'd be helpful in churches for people to know who are mental health professionals in your congregation that are willing to help out if there is a concern. And then mental health access centers. Are any of you, some of you might be familiar with these and others might not. They're fairly newish on our landscape in Iowa. We have different regions for behavioral health care that the state of Iowa allocates funding for. And there's 7 locations. There's in Sioux City has a mental health access center. Woodward and Dallas County, Des Moines and Polk County, Waterloo and Blackhawk, Cedar Rapids and Lynn, Iowa City in Johnson County, and then finally Ottumwa and Wapello County. These mental health access centers are open 24 hours a day, 7 days a week. They are a alternative to going to the emergency room. Some people feel much more comfortable going to the mental health access centers. They can provide assistance to people who are in a mental health crisis. And they also have substance use services too. So it's a very, very great resource available. I'm familiar with the one in Lynn County, so I can say that I'm on their board. And we know that this is a way of diverting people from having to go to the emergency room or to, actually, it's a good diversion for jail also, because sometimes they're able to go to the, take people to the mental health access center instead of taking them to jail. This can be they're working on getting emergency services to be familiar with these mental health access centers and able to take people by ambulance to them if that's even necessary. So really keep that in mind and become familiar with the mental health access center that's closest to you and your congregation. I was just going to think of, there was good news legislatively last year that I will share with you, because sometimes we need to hear good news about things that are happening in our legislature. And that was, there was absolute no dissenting opinions on this. The Iowa legislator got it approved so that insurance companies would cover taking patients to mental health access centers. Prior to that legislation, insurance agencies would only reimburse if you took people to the hospital, to the emergency room. So that was a huge plus in our state that that legislation passed, and so now those ambulance services can get reimbursed when they take people there. So, yay! Very, very awesome.
I have a question about them.
Yeah.
Do you have to live in the county where the access center is, or anyone can go to them?
Doesn't matter where you live.
Okay.
And it doesn't matter, you could be out of state even. So yeah, they're not going to be choosing that, because there's, you know, times when somebody might be having a crisis that's, you know, from another whole area of the state, and they're not going to turn them away. So. And they have the one in Lynn County. I don't know for sure about the other mental health access centers, but I can say the one in Lynn County, the director of that, her philosophy is that they are not a center that gives out pamphlets. And what she means by that is, if they determine that somebody, for example, needs services from the domestic violence shelter, they bring somebody from the domestic violence shelter there to meet with that person. Or if they determine that somebody maybe is having trouble with getting the food that they need for their family, and that's, you know, they would be bringing people in to help case manage that. So they really collaborate with, so it's not necessarily just mental health clinicians meeting with people, it's also looking at the whole person and making sure that they're getting their needs met. I'm just going to pause for a moment in case people have any other questions. Because now we're going to shift. We're going to be talking about protective factors. So protective factors are things that make it less likely for a person to develop suicidal ideation, that can help protect a person. They're things that are in the personal environment or personal characteristics that help people, protect people from suicide. And here are some of the there's a lot, but here are 5 kind of the big items. And one is effective and accessible behavioral health care. As I'm going through these protective factors, in the back of your mind, think about how could congregations or how could our faith communities impact these? Is there anything that we could do as a faith community that might help or make these even stronger? Connectedness to individuals, family, community, and social institution. People who are able to develop life skills, coping strategies, ability to adapt to change, those kinds of things. Having a sense of self-esteem, a sense of purpose or meaning in life. And then cultural, religious, or personal beliefs that discourage suicide and encourage help seeking. So trying to take away that stigma that mental illness often has. I was really unhappy to learn that someone in my church was told that mental illness was a character flaw. We have a lot of work to do. We have a lot of work to help people to understand that mental illness is it's a physical illness. It is something that people aren't choosing this. This is not something that people are choosing. Oh yeah, I really want this. It's the last thing they would want. So, and there's that the good side of it is that there is medical things that can be done that can help a lot. And we know different kinds of therapies that can help a lot. And we know these other things that are listed here that can help a lot. So anyway, I feel like I kind of got on a soapbox a little bit there, but I'm just curious, what are some of your thoughts that went through your mind as you were, looking at these protective factors and as far as, what churches might be able to do or faith communities could do?
I thought what you said about the access centers was super helpful and, is a new enough resource that I didn't know most. I knew 1 or 2 of them, but not all of them existed. So that's super helpful to have and to let folks know about. Yeah, thank you for that.
Absolutely. Absolutely.
Oh, Katie, this is Melody.
Yes,
Croaking away. I think some of the things that we do at Christ to develop connectedness, to get together, it's helpful. But I think what is especially helpful too is not just to have those of us who know each other get together, but to invite those that are kind of on the margins to integrate with the group. And I've just seen some really special things happen as people are welcomed and embraced and become part of our community. The other on cultural, religious, and personal beliefs, I'm wondering if maybe a retreat or something could open up that area of safety, of feeling that this is something that we can know and share with one another and encourage each other.
Awesome.
I think and I don't know how many leaders in faith communities do this, but I think it's important for leaders to have all of the information on what is out there to help their congregants. Not just the big things like the ER and the access centers, but perhaps some psychiatrists or oh, who takes Medicaid or things like that. I think that would be really helpful.
Mhm. Yeah, absolutely. The navigating the system is not easy. Not easy at all.
I guess one of the things I'm trying to do with one of our youth events is adding or weaving in coping skills.
Yes.
Because a lot of the kids are stressed out and they've got anxiety and they've got depression, and some of them are, probably involved in therapy and others aren't. So, trying to add those into areas where we can pretty seamlessly is, yeah, just one of the ways I guess I'm trying to do that. But that's a great idea what you said, Julie, like having more of that information out. And just as a parent, I know trying to find an in-person therapy is really hard. So maybe having some of the, flyers up for online options or something like that, as well as, 988 and all that. So
Right, right. We can go ahead and move on to the next slide. So do you agree with this statement that faith communities are a natural setting for suicide prevention? All right. How come you're nodding your head so much, Amy?
because, well, it blew my mind when I was told a few years ago that clergy aren't like given any kind of mental health training or like mental health first aid, like, because those are the people in my mind I would go to first. Like, if you can't get into a therapist right away, like clergy, a pastor, somebody would be the next step. And the fact that they're not trained on how to handle these types of situations at all is just mind-boggling to me. So yeah, I think that's why this is a natural setting.
Absolutely, absolutely.
I didn't have really in-depth training, and that I didn't go to a institution to learn about being a deacon. But one of the things in our the training that I did receive was that we shouldn't go beyond our capabilities and try to help beyond what we're really capable of doing. That one of our main jobs is referral, and
Yes.
so that having those sources of where people can go and maybe making the connection for them, but
Mhm.
not trying to do it ourselves.
I think that's an important point for sure. I think that with faith communities also that spiritual beliefs and practices can also really help people to experience maybe a greater hope um, and meaning in their lives, which is a big protective factor. Um, I think that we have opportunities if we have opportunities to really create connection for people. And Melody, you talked about that already. And Amy mentioned this as well. It's sort of the place that people oftentimes go. We hope when they're having difficult times. So we want to be sure that we're available. And a lot of times, and Amy, you mentioned this too, a lot of times people will turn to, if they are having a mental health crisis, will turn to a faith leader for support and help. So yeah, I think it's definitely a natural setting for suicide prevention. So here is another slide that talks about what kinds of actions can be taken, promoting that emotional well-being and connectedness, increasing that awareness and encourage help seeking. Identify and assist those who are at risk and be prepared for how you're going to respond to a suicide death. And then mental health advocacy. So one of the things that I'll talk about that we're going to be doing that at our church at Christ Episcopal is going to be providing on Thursdays during Lent a time for people to have a service that's a quiet time, sort of a healing service for people. And so we're hopeful that that's going to help, because we're just finding a lot of people are feeling a lot of angst right now and anxiety, whether it be because of personal things that are happening with them, or more on the national scale or whatever. But no matter the reason, we have people that are needing that time for healing. We're also going to be providing a connection online to a meditation. I'm going to be doing that. I'm a little nervous about it, but I've got my scripts ready, and we're going to be starting to record probably next week, so that people can go online. Maybe they don't have time to go to the Thursday service, but they could go online and click on and do a little mindfulness meditation, as well as a reflection and prayer for people. It's only going to be about 10 minutes or so, 15 at the most. So we're just hoping that maybe that'll make this a little bit more accessible as well. So those are a couple of things that we're doing. I think helping to educate people. There's many different kinds of mental health trainings, and we looked into a lot of them. I'll give Julie credit for that, because she really looked at these very, very hard. But we have, there's mental health first aid available, which is about a day-long training. There's also assist training. That one is for suicide prevention and how to respond to people who are in crisis. But that one is like 15 hours, I believe. And then there's QPR, which is question, persuade, and refer. And that's another shorter training, like a 3-hour training. So there's a lot of different trainings out there. And I think that it's really helpful to think about what people might be more likely to attend. And so that you're meeting the needs of people during this time. We've also had, in Lynn County, in Cedar Rapids, we have what's called the Hope Walk, which is it's a fundraiser to help give grants to any kinds of suicide prevention or education or response efforts in our community. And we had a group from Christ Church who participated in the Hope Walk. In addition to being a fundraiser, it also was a way of helping to remember those who we've lost to suicide, and to give recognition to those lives, and also to have an opportunity to have somebody who, there's usually a speaker who will be a kind of somebody who gives you some motivation also for the work that goes into suicide prevention and intervention and response. Another thing we found for our church is we found that the 988, there's a lot of free posters that you can get, and we also had these little cards made that are in each pew that has 988 and information about what that is and how they how people can access that. And I was thinking maybe, we have posters that are up like in the kind of common areas and restroom and stuff with the 988. So just really trying to get the information out there to people. I'm kind of wondering if maybe a next step might be to get information out there about like the Mental Health Access Center, for example, or maybe even how to contact like 211. 211 is a phone number that's for referral. But anyway, those are just some ideas that I have as far as what are some things that we can do as faith communities to take action. And I'm just wondering what other people are thinking about. Either things that you've done or things that you think you might try.
We have a mental health first aid trainer in the diocese, so we're the behavioral health ministry teams trying to get some of those trainings set up kind of all over.
Awesome.
So people have access to those free of charge. But I love the idea of putting the 988 cards in pews. That's a great easy way.
There's also been some like a sermon that was done just to help people to recognize mental health issues and concerns and healing.
Katie, I have a question.
Yeah.
There are a lot of people in, I'm really pretty certain this isn't just our church. There are a lot of people everywhere in faith communities and other communities that have mental health issues. And it's still, even though you can be as open as you can be, there's still, people still whisper it to each other, if that makes sense. Say, oh yeah, I have depression. Oh yeah, I have depression too. I've often, and I don't know if this is a really good idea or a really bad idea, to have some kind of informal support group within churches. Again, I don't know if that's a good idea or a bad idea to do. What are your thoughts?
Well, for one thing, I think we also need to recognize that there's people who might have cancer or might have other kinds of ailments that are whispering it too because they don't want to talk about it to people. And that's okay. You know, it's also okay to protect yourself in that way. But when it's done out of shame, that's a whole different story, you know? And I think what you're saying is more maybe a sense that it's a shame, it's out of shame, not out of privacy.
Yeah.
You know, just like with anything, you know, what would it look like, and you know, what are some of your thoughts about like who would be the kinds of people that might gather in that way?
I don't know. I guess one of my concerns is that if there's no professional leading it, that might be problematic. I guess I don't know. I go back and forth on it.
Yeah. Well, certainly there's a lot that's happening also with peer support. And that is a kind of a big trend, I would say, right now in mental health, which is having people who have lived experience with mental illness, or sometimes with substance abuse also is another area where we're seeing more and more peer support. But those peers are trained. So there is a certification. So they might not have gone to school and gotten a master's degree and then gotten a license and all of that, but they certainly have lived experience that is incredibly valuable and oftentimes can maybe even relate to people on an even better basis than sometimes professionals can. So there's a real strength in that as well. So to me, I would feel probably pretty uncomfortable if it was a group of people that gathered without somebody who's trained to kind of help facilitate and to know what to do if someone ends up having a mental health crisis or in mental health crisis, to make sure that they get the support that they need, and yeah. So does that kind of?
I know that's perfect. That makes a lot of sense.
Yeah.
Thank you.
I wonder if there's space for faith communities. Like, I feel like a lot of faith communities are really good at feeding each other. So like if people have new babies and stuff, they'll do meal trains and things like that where you can sign up. But I wonder if there's something that could be done with like meals or cleaning, like I'll come over and do your dishes, so that if folks who are like, that was kind of when my depression was at its worst, it's like dishes and laundry were how I could tell like kind of when I hit my limit on that. And I don't know that I would have been in the headspace to, you know, ask for that help. But if that was something that was promoted all the time and was kind of in the back of my head, maybe that type of support could be useful to people.
Right. And yeah, and people being aware of how those, again, it kind of gets back to, sometimes I think people think, oh, well, I can't do anything to help because I'm not a mental health professional. But those everyday things like that could make a huge difference, just like it can make a huge difference when somebody's had surgery or something, Yeah. Other ideas or thoughts? We can go on to the next slide then, because I do want to be sure that you're aware of these different resources. So let's just start with the top one is from the Suicide Prevention Resource Council, and it actually has guidelines and suggestions for faith communities. And I don't know, Amy, would you be able to click on that and be able to open it?
I clicked on it, but I think because I'm screen sharing the PowerPoint, I can,
Oh, okay.
I do have them all open. So if you want, I can
Oh,
switch.
yeah, that'd be fine.
Give me just a second.
Yeah, I don't have, actually, the rest of my slides are really, we don't really need, other than my contact information. So if you kind of scroll through this, you can see some of the things that are available on this website. And you can scroll down even further, I believe. Yes, there you go. So they have after the suicide recommendations for religious services and other public memorial observances. I think that can be extremely helpful. I remember when we had, we always struggled with schools with trying to figure out, you want to memorialize the death, the life of someone, but we also got really concerned about contagion effect and suicide clusters and that sort of thing. This guide was very, very helpful to help work through those kinds of issues, and so that, and it really helped some school communities to be able to come together and do it in a way that we knew was best practice. And so anyway, that was what I wanted to point out. Rural men are, and if you look down to the one there, meeting rural men where they are, rural men have a very high rate of suicide. And so really learning more about that is very important for all of us, especially living in Iowa, in such a rural community or rural state. And yeah, there's a lot of, there's some webinars as well as handouts and that sort of thing on this website. Let's go ahead and go to the next one. So this is the national strategy 2024 for suicide prevention. Department of Health and Human Services has put this out. And my hope is that this will continue to be something that is supported, as it does have a lot of information about what we can do as mental health providers, as well as with communities and within the communities. And it really is looking at a comprehensive approach to suicide prevention. So you can kind of just scroll down a little bit there so people can maybe have a little, there's a download that you can do. And the one that I've looked at the most is actually the community-based suicide prevention. I think that one was particularly helpful to be able to see that. And it kind of gives the different goals that they have for that particular strategic direction that they've identified. And they do have action plans around it. So this is something that I think maybe as a diocese, we could take even a closer look at to see if there's some things that we might want to consider. You can go to the next one. And this is an organization that actually I just found as I was preparing for this. So I don't know a ton about it, but what I could see looked like it was very geared toward best practice and in addressing mental health ministries, as well as the workshops that they would provide. So it's just something that I thought, well, that's something to maybe take a little deeper dive into to see what is there. Any other, if you could just, yeah, there we go. I'm going to put this on my gallery view so I can see everybody who's on. Other thoughts or considerations? I do have a closing prayer I'd like to share with you. It is by Maya Angelou. Father, Mother, God, thank you for your presence during the hard and mean days. For then we have you to lean upon. Thank you for your presence during the bright and sunny days. For then we can share that which we have with those who have less. And thank you for your presence during the holy days, for then we are able to celebrate you and our families and our friends. For those who have no voice, we ask you to speak. For those who feel unworthy, we ask you to pour your love out in waterfalls of tenderness. For those who live in pain, we ask you to bathe them in the river of your healing. For those who are lonely, we ask you to keep them company. For those who are depressed, we ask you to shower upon them the light of hope. Dear Creator, you, the borderless sea of substance, we ask you to give to all the world that which we need most, peace. Thank you so much. It was
Amen.
delightful to do this. So take care.